good morning, good afternoon, and good evening. Wherever you're joining from, welcome to today's webinar. So today's topic is supporting caregivers and families of patients with serious illness. Today's session focuses on a very sensitive topic as CWC embraces all sections of the community and their diverse health-related challenges. Today, we'll be diving deep into an area that needs a lot of attention for struggling people in the community. For instance, having the right resources, information, and network to support seriously ill patients is undoubtedly a problem that needs to be solved. Without proper support, it may remain unknown and get buried under the agony of those people and families' challenges. Today's session is in partnership with Stanford Care, Center for Asian Health Research and Education. CWC's collaboration with Stanford Care covers events, surveys, research, and clinical trials. And today we will also have a couple of families to share their firsthand experience in these kinds of really tough and heart-touching situations. This event is brought to you by Crack the Wellness Code, a program of ICC, India Community Center, North America's largest secular community center for South Asians, serving the community for over 17 years. My name is Praveen Nara. I'm the founder and CEO of TechDatas, a digital transformation and custom development software agency. I volunteer as an event coordinator for CWC and Thai Global. I would like to thank the people who made this event possible, co-founders of CWC, Dr. Pankaj Ridge, Naren Bakshi, and Somnath Chatterjee. I would also like to thank Raj Desai, CEO of ICC, and the latest chair of Thai Global, Praveen Thailam. Today we have an amazing panel, like I said, from the field of psychiatry and behavioral health. Our main speaker today is Dr. Ranak Trivedi. She has PhD in clinical health, and she's a psychologist from Stanford. Not only will we discuss the critical challenges faced by families of seriously ill patients, but also survey the community with Stanford Care to find out how we can best help those people in need. Thanks to our lead speaker, Dr. Ranak Trivedi, for taking this initiative with CWC. Dr. Trivedi is associated with Stanford Medical and works with Stanford Care. Dr. Bhatt, PhD, is a certified biofeedback specialist with doctoral degree in clinical psychology, and she's currently the clinical director at Concord Weight Loss Clinic and a professor at Saybrook University in San Francisco for doctorate students. Dr. Bhatt, welcome.
Thank you, Praveen. Thank you, everybody, for joining this session. And it's my pleasure to be here today. Today's topic is very much emotional, as well as we would like to give you some information where you can take this information, measure, monitor, and modify how you can solve some of the problems. So today's topic is supporting informal caregivers and families of patients with a serious illness. In other words, it's caregiver fatigue and compassion fatigue. Fatigue or burnout occurs due to overload. The overload depends on three factors: frequency, size of the load, and duration of the load. Just imagine you're carrying a heavy box and then your muscles are fatigued, and it's based on how many boxes you carry, how far you carry, and how heavy it is. Similarly, when you are taking care of somebody, your kith and kin, fatigue occurs in physical, mental, and emotional factors. For that, today's topic, we are going to give you how to measure using measurable scales. Just like when you go to a doctor or when you have to measure your blood pressure or your weight, or when you have say diabetes, and then you check your uh, blood sugar. There are many scales where you can measure what is happening to your stress and burnout. One of the most user-friendly that you can use, and I will give you some of the link, is Christina Mashlow's burnout measure scale. That in fact, we had the pleasure of working with Christina and developing a test on anxiety in UC Berkeley. And the other ones are AMA, caregiver burnout scale, and then APA burnout scale. Why we need that? Because it's not only taking care of the patients, and we need to take care of ourselves. And with that introduction, we have a very special speaker today, Dr. Ranak Trivedi. Her name itself says Trivedi. You can tell how smart she is. So, and she's a professor at Stanford, and she's a clinical psychologist, especially in the health, the Department of Psychiatry, and she's a professor. And her special interest is in South Asian community, and she will give you, and I am very proud to present to you Dr. Ranak Trivedi, and she will spend some time in showing you the slides and what are the problems and how we can solve those problems, and how you can get involved in the community in helping others and help yourselves. It's my great pleasure to introduce to you Dr. Ranak Trivedi.
Thank you, Dr. Budd, for that introduction. And thank you, everybody, for spending an evening or early morning or afternoon with us. I wanted to start off by acknowledging the dire situation in India right now around COVID. We've been hearing a lot of news around this, and my thoughts and prayers are with you, if you and your friends and family who might be in these situations. And I really hope that we see the end of the crisis soon. I think the COVID pandemic is also really relevant to this talk, even though I'm not touching on it specifically, because we know that those with chronic and serious illnesses have been really having a tough time with the pandemic. People who have gotten COVID have experienced organ failures and worsening of their conditions. We've also seen that there's been delays of care, especially around things that are treated more in the outpatient settings and mental health care. We also know that caregivers have suffered specifically during the pandemic. So while pandemic has affected all of us in significant ways, those people who we're going to address today are really especially affected. So I'm happy to provide this hopefully very timely talk. So I don't have any financial conflicts of interest to declare. Let me just start by talking about what we mean by chronic and serious illnesses. Chronic illnesses are conditions that are last a year or longer. So things like hypertension, diabetes, and depression. Serious illnesses often also last 1 year or more years, but they also come with a high risk of mortality or death. So we're thinking metastatic breast cancer or metastatic cancer in general, heart failure, dementia, COPD are all serious illnesses. These conditions among Indians and other South Asians are some of the deadliest. Last year, or I guess 2 years ago, 2019, they were some of the leading causes of deaths in India. Ischemic heart disease, chronic respiratory disease, which includes COPD, and cancer are all chronic conditions that were in the top 5 fatal conditions within the country. In the US, this is a very similar, data are very similar. At least almost 60% of adults in the United States are living with a chronic condition, and 12% of the US adults are actually living with 5 or more chronic conditions. These conditions are a huge driver of the healthcare in the United States. 90% of all healthcare related costs are actually due to the management of chronic conditions in especially inpatient settings, like hospitals and skilled nursing facilities. And managing these conditions is hard. So many of you are familiar with some of the chronic conditions or are even managing your own conditions. And you probably can relate that there's a lot of recommendations that people get. You have recommendations of taking medicine. Often there's some physical activity recommendations, typically to increase, sometimes to decrease. There's often some diet recommendations like low salt or low sugar or low fat. Many conditions also require constant monitoring. Even something like hypertension, it's recommended that you do daily blood pressure monitoring. Something like heart failure, which is a more serious condition, people have to watch for increase in weight or shortness of breath. It also includes things like preventive care, like getting your flu shot or now your COVID vaccination. These types of activities are called self-management activities. What that means are all the things that patients are asked to do outside of the clinical setting to optimize their outcomes. What makes this even harder, apart from just the number of things you have to remember to do, is that you often experience worse health and lower sense of well-being. And many people with a chronic and serious condition also are at high risk for depression. For example, in heart failure, about 40 to 70% of people report depressive symptoms. What helps patients take care of themselves are caregivers. What do we mean by caregivers? Caregivers are family members and friends who often provide unpaid care to their loved ones who have a medical or mental health condition. As of 2020, there were 53 million adults providing unpaid care to caregivers in the United States. Caregivers provide $470 billion of unpaid services. That's a huge price tag. And this number has most definitely gone up. So this is a big number. I can't wrap my head around this very much. So I'll give you a context. This rivals the market cap of these major Fortune 100 companies that we know very well, which means that if caregivers were a company, they would be a Fortune 100 company. Caregivers are crucial to the self-management success in chronic and serious conditions. You can think of your own lives. You are probably a caregiver to somebody or you're receiving care from somebody. Caregivers may provide emotional support like coping, may provide instrumental or practical support, which can range anywhere from running errands to providing support around bathing and dressing. More and more caregivers are being asked to provide complex medical care to people at home, like doing wound care or providing injections. Caregivers also provide patients with care coordination by coordinating various specialty care teams and advocate for patients so that they get high quality care. It's probably not surprising that this comes at a great emotional and financial cost to caregivers. Caregiver burden is very common, and it's determined by the number of hours and the intensity of care. So for dementia, for example, people may provide on an average 20 to 40 hours of care a week, which is a half to full-time job. There's also a financial cost. On average, caregivers pay about $7,000 out of their own pockets to help somebody care for their conditions for things like transportation or supporting for copays. For certain conditions like cancer or rare diseases that are more expensive to manage, this number is significantly higher. This is a report that came out last year, and these are pre-pandemic data, where there's a 10 million increase in the number of caregivers just in 5 years. Now 1 in 5 adults within the United States identifies as a caregiver. And caregiving is becoming harder. More Americans are caring for more than one person, reporting worse health, reporting difficulties coordinating care. They're also sharing that they've had at least one financial impact because of their caregiving roles and impacts on their professional careers. And this situation is about to get worse. Only about 10 years ago, there was about 7 caregivers available to adults 80 years or above in the United States. But in about less than 10 years from now, this number is projected to drop to 4 caregivers per an adult who's 80 years or above, which means that the amount of care being provided is now more concentrated likely leading to worse outcomes. So if you are a caregiver, what can you do? Well, you can start by taking care of yourself. We often feel guilty when we do not feel like providing care, whether it's care for medical or mental health conditions, or even just caring for young children. That's okay. It's okay to feel guilty about it. Create a schedule that allows you to take breaks. Get help from other family members, friends, and even nursing aides. Among South Asians, there's a reluctance and stigma to obtaining home health care or using services like respite or long-term care. It's very important that these get added as options when needed. It often helps to talk with people like you if you're in this situation. But if you start feeling that you're more depressed, stressed, or burned out, definitely talk to your primary care provider or a mental health professional who can help you. There's also really great resources out there. These slides will be made available to you, so you can find these resources or you can email me. I'm happy to share. These are some really great resources that also list other resources within these links. There's also a great organization in India called Caregivers Saathi, and they have a Facebook page as well. I highly recommend you join them. They really push out some excellent talks and materials. Switching to a population that's relevant to this crowd is caregiving among South Asians. Why should we focus on South Asians? South Asia comprises these 7 countries: India, Pakistan, Nepal, Bhutan, Bangladesh, Sri Lanka, and Maldives. There are 1.9 billion South Asians worldwide. 5.4 million South Asians live in the United States, and it's the most rapidly growing demographic in Santa Clara County, which is where we're located. Across the 7 countries, there are 419 spoken languages, and all major world religions are represented. Despite this diversity, there are shared cultural experiences that may have special salience in navigating serious illnesses. These are things like multiple family members who are involved in their care, expecting women to take on more of the caregiving responsibilities, and stigmas around conditions like cancer, which delays care sometimes fatally. Yet the South Asian experiences remain unknown and hidden within the healthcare system. Caregiving in South Asian cultures is culturally determined. South Asians are collectivist. We prioritize the needs of the group over the needs of the individual. There are motivations and expectations that are culturally embedded. So while in the Western culture, a lot of the caregiving is determined by love and affection, in the South Asian culture, often the motivation is family responsibilities and expectations based on intergenerational roles and gender roles. So you may have noticed that in the US report, 61% of caregivers are women. In India, 80% of caregivers are women. Another thing that makes it complicated is that we believe in the concept of seva, which means that taking care of somebody is similar to an act of devotion. So providing care can be seen as a privilege, making it really difficult for people to share a negative experience or feel guilty if they feel burned out or stressed. As people navigate, especially the healthcare system in the United States, they might run into barriers around health literacy and language. And the healthcare system is not designed to handle this cultural context. Caregiver needs is vastly understudied in South Asian countries. There are no national representative data sets that we can use. This study, which is a few hundred people, found that 67% of caregivers spend 10 or more hours caring for the patient, and more than 50% reported depression, especially if they cared for a spouse, lived with patients, had additional responsibilities beyond the healthcare, and provided at least 10 hours of care a day. And in this particular study, everybody was at least moderately stressed, and 18% were severely stressed. This is also personal. These are my parents. I have seen the firsthand how caregiving can occur. Like many South Asians, my dad was diagnosed with heart disease at a very young age. My mom was diagnosed with breast cancer almost 20 years ago, and we've been managing metastatic breast cancer for about 15 years. I've seen them be each other's primary caregiver, as well as being caregivers to other friends and family, including my grandmother, who is now 95. Let me give you an example of the cultural context that I talked about, when I said the healthcare system is not designed. In 2001, in my first week of my PhD, my dad had to undergo emergency bypass surgery. They live in Chicago, and I was living in Durham at the time. And so I took the first flight out the next morning, and I knew that by the time I get there, the surgery would be over. This is before it was really easy for cell phone connectivity. So there was just this gap of information from the night before to when I landed. When I got to the hospital, I did not know what to expect. I expected my mom to be very stressed out and anxious, understandably. I expected my brother to also be worried. And when I walked in, it was not what I was expecting. It was like a party. There was about 30 people in the waiting area where family members can wait for news from surgery. Family, friends had come to support our family. And there was chai, there was nasta, there was jokes, there was humor. And my mom was sitting there laughing and cracking jokes. And I was just really struck with just the amount of support that we as a family were receiving, that was getting our mind off of what was happening in the operating room. At the same time, in that waiting room, there was a white couple who was waiting for news, and it was completely different. You could tell they were anxious and worried, and they were probably upset with us because we're making so much noise. But what healthcare system is designed to accommodate 30 family members and friends for each surgical patient? But that's what we need a lot of times. That's what South Asians require. So we need robust strategies to support caregivers. We need changes in the way we deliver healthcare. We need robust national policies. I'm thrilled to see that the Biden administration has made caregiving an important part of their infrastructure plan. We also need scientifically sound programs and approaches, as well as develop culturally attuned approaches that reflect the diversity of experiences as we manage chronic and serious conditions. And finally, we're going to need strong implementation strategies and population and public health strategies to improve the uptake of these programs. So my vision is to improve the healthcare delivery by supporting culturally diverse caregivers of seriously ill patients. And I'm going to spend the next few minutes talking about our new study called Suffered, which means succeed in Gujarati, my mother tongue. The goal of Suffered is to understand the experiences of South Asian women living with breast cancer, but also understand the experiences of their family members and friends who are supporting them. We want to understand what the healthcare system can do to address our cultural needs as we are going through this really serious condition. And eventually, our hope is to develop a program that can address these unmet needs. This is more information about our study. These flyers will be available to you, or you can email me. I'm happy to send them out. We are looking for people who are South Asian, either diagnosed with stage 3 or 4 breast cancer, or their family members or friends. We are asking for people who may speak English or Hindi. And this is the information that, the study information that you can look up. This is our study website. Again, this will be available in the slides when they get sent to you. So please look us up and spread the word. So a question I get a lot because I'm a researcher is, why should I participate from my family members and friends? And there's some understandable skepticism of minorities participating in research studies. But this is the downside. Right now, almost 60% of the world's population identifies as Asian. So not South Asian, but Asian. However, if you look at the participation in clinical trials, less than 12% of clinical trials enroll Asians in their research. These are drug trials, and we've seen this going around with the COVID, where we know that the participation in COVID trials is very low among Asians in general, South Asians in particular, which means that decisions that are made for us are made using data that is not obtained from us. So I strongly encourage all of you to think about participating in research studies that you may qualify for, so that we can get our voices, our perspectives also heard, and frankly, our physiology get represented in these studies. So with that, I'm going to end with a quotation from former First Lady Rosalind Carter, who is a tremendous advocate for caregivers and has just transformed this landscape over decades. There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. With that, I thank you for your attention. I hand it back to the moderators. This is my information. Please feel free to contact me.
Thank you, Dr. Ronak Trivedi. That was very informative talk and really, really helpful. Wow, 40 to 70% of heart patients feel depression-like symptoms. That's like one in every two people. They definitely need help. And even the other statistic you shared, like 20 to 40 hours per week of care for dementia patients. That's a lot. And especially if somebody has other jobs and stuff like that that they're taking care of, it becomes really, really tough, I guess. So with that, Dr. Butt, any comments?
Yes, thank you, Ranak. It was excellent in terms of giving information as well as giving some resources where people who are the caregivers and then taking care of the families, where and how they can be involved in terms of not only giving the care as well as taking the support from those areas, and which is very important to take care of themselves, which is our topic today. So in that respect, you have a lot of resources, and then I urge people who are in need of that, they should take advantage of that, so that especially South Indian community that hesitate to do that, to take advantage of that, and it will be very helpful. And then take care of yourself and the South Asian community. I urge you to take care of yourself as well as your kith and kin.
Thank you, Dr. Butt. Now I would like to invite a couple of different families that are caring for their loved ones who are going through some really tough, serious health conditions. And as you can all understand, there is stigma in our community and several other communities where people don't talk about the challenges that they go through. They keep posting all these, fancy pictures on Facebook, Instagram, etc. Only the positive things, and that discourages people to even share some of their tougher challenges. And these two families are being so vulnerable in sharing their experience because they want to help the larger community and help other people who are going through similar situations seek some help and also open up and get the help they seek. So with that, first, I would love to invite the Datta's family. And Datta's family will be represented by Debo Datta. And Datta, please welcome and share your own experience.
Hi, thank you very much for inviting me. And this is an amazing panel. And thank you, Dr. Bhatt and Dr. Trivedi, for the overall framework. So I'll give you a very quick journey into our kids' medical condition. So our 4 years ago, approximately, our then 5.5-year-old was diagnosed, seemingly healthy, completely healthy child was diagnosed with leukemia. And of course, the world completely changed for us. And it was an extremely like a dark tunnel where we didn't know what was going on. We didn't even know what to ask, how to ask for help, and we like kind of took it one day at a time, and we were like scrambling to find information. And I won't belabor all the points. I mean, some of the points have already been made by Dr. Trivedi beautifully, like what we need. But what we really saw is a complete lack of support system when you go through, especially when your child, I mean, there are different challenges when you go through it versus your child goes through it. So when your child goes through something as adverse as that, like it is very, very hard for, first of all, as Dr. Trivedi mentioned, it's it's hard for our families to even grapple with that situation. And we've seen that people uh, people grapple it in different ways. We went kind of numb, the parents, my wife and I, we went numb, and we just said, okay, we'll just take it one day at a time and do whatever it takes to help our child. Our parents reacted in a different way. My in-laws, who were already in the US visiting us, they uh, reacted in a totally different way. But and of course they were of great help. But what I meant to say is that we didn't know exactly what to even expect. And especially with cancer, cancer is a taboo word in India, right? And especially leukemia. So, like, it was very hard to get basic help on and information. We were being told to sign up for clinical trials, which we didn't understand. And but over the next 2 3 months, I mean, and it's a long treatment. It's a 2.5 years therapy, and then you have to keep doing follow-ups and ensure that it never comes back. And not ensure, like, just you have to pray that it never comes back. You cannot do anything beyond that. And we were very lucky that so the first 2 3 months was intense, but we figured out how to navigate the system, what questions to ask, how to ask for help. But it took us time. And honestly, if we had that kind of information, we would have done a few things differently, like second opinions and just for the therapy. But in general, I just wanted to talk about, like, the in case any of you are having any kind of adversarial health issues in your family, especially with your kids, I think there are a couple of buckets of support that you could go into. One is, number one, since we have to maintain a job to get and ensure our health insurance is in order, do talk to your workplace support, because most people don't even know how to react to this. They don't even know uh, what kind of programs your workplace may have. And that's something that we learned. I learned very late that we had even in my then employer, we had a second opinion service. So please go and talk to your HR. Don't feel shy. I know a lot of parents feel shy about it. So there's workplace support. Then there is obviously, you know just the support around the therapy. I mean, each adversity is different. For leukemia, there are also different types. So, I mean, medicine is so hyper specialized that my recommendation is that please find a support group within that hyper specialized condition, because otherwise you may not get the right answer. So that's like, for second opinions, or even people just to know what questions to ask. Then the third bucket is like quality of life support. That could mean asking for friends, um, uh, asking your friends to help, asking support groups to help you come and spend time with your kid or your adult, whoever, family member. Sometimes, because, I mean, as the pandemic has taught us, sometimes, and as Dr. Trivedi rightfully pointed out with the 30 people party that was happening, it's very important to have that kind of support, social support. And for example, when my child was going through chemotherapy, we found a lot of Bay Area amazing, uh, you know, nonprofits who would, one of the nonprofits organization, especially like Kids Are Not, their only goal was to help kids going through cancer heal themselves with art. So there are all these support groups. You just have to know where to ask and how to get involved. And that was a single thing my child used to look forward to once a month. Um, so that's pretty much like, so there were the three buckets, and the other one, caregivers, your own support. Because, in the airlines industry, they say first put on your face mask before you put it on your child. So it's very important to it is very important to recognize that this is typically, these adverse conditions are long-term caregiving, and there's going to be caregiver fatigue. We thought this was just some term that's been cooked up over here, but it's real. It takes you. My health took a toll after the 2.5 years of therapy. And for people who have continuous caregiving to do, I don't even know how to even understand what kind of support they may need. So with that, I'd like to hand it over to the moderator.
Yeah, Debo, thank you so much for sharing that heart-touching feeling. I was actually getting goosebumps here. It's hard to see somebody go through cancer, leukemia, or anything like that, let alone your kids, right? It's different to see it in other relatives, elder people, but when you see it in child, it's even harder. So, um, my best wishes so that your child recovers quickly and completely. I know there are a lot of different medical procedures and other options out there, and many people have recovered as well. So I wish that your daughter recovers well as well.
Thank you.
With that, let me now invite the second family. The second family is going to be Nurani's family, represented by Ajmal and Tripti Nurani. Please welcome and share your experience.
Thank you, Praveen. I can relate to what Debo just mentioned, because this is, as he mentioned, it's something that the entire family goes through. So in our case, our son has a condition called Duchenne's muscular dystrophy. It's not very well known. It's fairly common, but most people don't know what exactly it means. So essentially, the body lacks. It's a genetic disease, and the body lacks the dystrophin gene, which means that protein, when it's created, is being destroyed by the body, because the body does not recognize it as natural, and as a result, the muscle wastes away over the life, and it's a degenerative disease that results in early death. But as we found out, it's been for us in our case, it's been about 17 years ago, and clearly when we first found out, it was devastating. Um, I think the issue with regards to understanding the illness and learning about that came fairly quickly, because the medical profession, the Muscular Dystrophy Association, all of them came together to share that with us. But from a caregiver perspective, I think it's something that has been an eye-opening journey for us. I think there were multiple aspects to it. One is obviously physical. And I think the COVID situation obviously is relevant over here, because about a year ago when COVID struck, we decided we couldn't afford to take the risk of having a home care aide come in and help us, which we used to get for a little while. So at this point in time, we are pretty much taking care of his need. Our son is now 23, and so all his bathing, getting him out of bed, putting him in his wheelchair, all that stuff has to be done by us. We obviously don't go out much because it's better to be safe. But we're all vaccinated, and hopefully everyone will be sooner or later, and we'll get through this. What we found was that there wasn't much awareness in terms of what support systems are available. And there's still a lot to be done. We found support that came to us without us looking for it, thankfully. And it's probably relevant to our county and the area we live in. But through the school, we found out about the IEP and the 504 program, which allowed him to get some special accommodations at school. They also made sure that he wasn't thrown out of the school, because naturally, this is not just a physical issue, it's also an emotional issue. So he started acting out in school, and some of the school counselors and professionals who were there basically said he needs us to be taken out from a regular school and sent to a special needs school, which really wasn't needed, because his mental faculties are fine, and they just needed to take care of that. Luckily for us, the county healthcare system and the people who were assigned to us, I think it was the county psychologists, they came into those programs and sided with the family and made sure that he was able to continue and finish his high school at the same school. They also assigned a psychologist from the county It's unfortunately a program that has been discontinued because apparently the funding ran out. But they were very helpful because at that point in time, he had gotten to a situation where the doctors had basically said, oh, he's feeling down, prescribe Prozac. Much later, we found out that, especially for teenagers, that's actually not a great thing because it has been found to lead to suicidal tendencies. And that's exactly what happened with him. He started cutting and then eventually ended up in, we had to call the doctors. I mean, we had to call the emergency, and they took him to a hospital and kept him there for 7 days under observation. And they finally only released him when we agreed to have a psychologist take care of him full time. Unfortunately, that ended up being a quack, highly licensed and very decorated psychiatrist in Marin, but he basically spent 10 minutes and said, here's Adderall, which didn't help anything. The clinical psychologist that the county assigned at no cost to us took him off all medication, observed him for a month, and then found the right medication that worked for him and is working to this day. But we owe them a big debt of gratitude because they made sure Arman was able to continue in the school. He got the right psychological help. But these were things that we just didn't know. And from a support system, besides the Muscular Dystrophy Association, which sends us a monthly newsletter and keeps us abreast of the research that's going on, there isn't a lot of, we found out later that we could get help from the state for getting caregiver, support. And we pay a lot of taxes, but it wasn't something that was known to us. So some of these things came to us late, and I would recommend anybody who goes. Unfortunately, I hope no one has to go through this, but if you do, clearly a support system is needed. We do live in a very isolated environment in the U.S. particularly. I think we had a lot more, either a joint family or at least much more community support. Whereas here, I think our family's on the West Coast, somebody's on the East Coast. Lots of folks are all over the world, and so getting help is important from all the networks and all the systems that are available. So I encourage, I appreciate this forum to share our experience and also to encourage the CWC to look at how best we can meet the needs of families with special needs. Thank you.
Thank you, Ajmal. Yeah, it's really hard and heartbreaking to hear some of these stories. It's unfortunate that some doctors treat some situations as if they are Prozac deficiency. Sometimes I feel like they don't take the risk to, the county psychiatrist, for example, took the risk in taking Arman off the medication for a month. That's a big risk, but that led to some discovery of the right medication. I think having some help on both sides of the table to help the patients the right way would really, really help. So thank you for sharing that. With that, I would like to open up this session for questions and answers. I do have a question from Vidya Kala. And she says, a very good question. In good old days, there were joint families and they were living together, and caregiving was distributed among multiple people so that they're not stressed out and they're able to talk to other people, etc. With changing social dynamics, kids moving away, and aging population, how do you see caregiving shaping up in years to come?
Yeah, it's a really good, thank you so much for that question. I want to say that the caregiving was distributed among women. It was not distributed amongst family members. So I think it's really important for us to recognize that caregiving remains a very gendered, it's very gendered, and there's still predominantly women are providing care. And we've seen that during the pandemic as well, that women are leaving the workforce and to take care of young children, take care of people at home. Having said that, of course, as one of my colleagues says, the remainder of care is provided by men, so it's an everybody issue. I think this is where a lot of the policies will come into play. I agree that when there's more of a community setup, people are available to provide care and distribute the workload, especially around practical tasks. But I think we need more policies that support the alternate arrangement where you may have families living far apart and we need people to be involved in the care. So for example, if you're a long distance caregiver, which a lot of us are for our loved ones in other parts of the country or the world, can we participate in the clinic appointments virtually so that we can hear firsthand what is required for us? The other thing is we're going to rely more on social structures rather than social systems. The infrastructure, for example, people like home health care services could be an example, or nursing care, or respite care, long-term care. So I think being able to rely more on other infrastructure is important. But I think we also just need better policies to support directly the needs of the caregivers. We need to normalize the experience of caregivers. We need to provide strategies in which the healthcare system screens caregivers for their stress, their depression, their anxiety, their own concerns. There's a statistic from a survey that was done now in 2015 among cancer caregivers, and only 16% of cancer caregivers had been asked by anybody in the healthcare system how they were doing, and fewer were provided resources. Whereas the caregiver stress for cancer caregivers is quite high. So we need to normalize addressing the needs of caregivers.
Definitely. And I know that there is more organized long-term care here in the United States. It's not as organized or as well known or as well accepted in the community in India. So do you have any recommendations for those people looking for long-term care in India?
You know, there's a lot of Alzheimer's advocacy groups that I've come across that are actually taking the lead on that. The Caregiver Sathi website that I just shared, if you look up Caregiver Sathi, SAATHI, they're doing some phenomenal work around resourcing within India. They do a lot of talks, they do a lot of just informational push outs from their website. So if you're in India looking, some are general, so it applies no matter where you are, but they actually have a lot of resources that are India specific that would be worth looking at.
Thank you. And this question is from Raju Mehta, and he would like to know a little bit more about the SAFAD study that you mentioned. What are you looking for? What is involved in it, and how is it different from other trials and drug studies?
Yeah, this is more of a formative study. We're not testing anything yet. Because there's so little known, what we're trying to do is really just talk to women, South Asian women who've undergone breast cancer and their caregivers to understand what their experience was like as they navigated the cancer process. So there's two parts to it. One is surveys that you just complete online. And then if you're interested, you could participate in an hour-long interview with one of our staff members. And the interviews can take place in either English or Hindi. In fact, my understanding is that when a link to this video will be sent out next week or so, the ICC and Correct the Wellness Code has kindly offered to put the link of the survey itself within that email. So please be on the lookout for that. If this applies to you, meaning if you are somebody who is managing breast cancer or is helping somebody manage breast cancer, then that's what we are really interested in. We want to know what your experiences were like. Our eventual goal is to develop a program to address the needs, but right now we're still looking for insights as to what we need to do, what kind of intervention is needed.
Got it. Thank you. And this question is from Naren Bakshi, who is a co-founder of CWC. Some of these issues are cultural and have a stigma associated with them. What do you think the Indian community could do that is practical and to take care of these situations?
You mean the diagnosis? So things like stigma around cancer diagnosis and such?
Yeah, getting out of the stigma and being more open to be able to talk about this and seek the help they need. That's what I'm assuming.
I mean,
Dr.
yeah, I think Devo's family and Ajmal, the Nurani family just demonstrated beautifully how we can do that, where I think a big part of will be for us to talk more. And when people share things with us, to not stigmatize that experience. There's a tendency in the South Asian culture to talk about some, prior life bop you've done that has now carried over and is like you've deserved this because of prior life's actions. That type of approach is very culturally embedded, but it's very fatalistic, and it actually puts the burden of a diagnosis on the individual. And in breast cancer, especially because it's a women's disease and because there's a lot of stigma around, and around privacy around reproductive organs, there's actually some heartbreaking stories I've heard from friends and family where people delayed their care until the cancer had metastasized so much it became fatal, because they themselves knew that they had breast cancer, that something was wrong, but they didn't want to go to a doctor and bare their chest and get an exam. So I think we need to start normalizing these as medical issues, not individual issues, not something that's anybody's fault, but that they all deserve care. And especially when it comes to women's health issues, we need to create a more awareness of how we can do a better job of screening for these things and normalizing the screening of that, and making sure that people are getting treatment and diagnosis in a timely way.
Yeah, that's definitely true. And maybe providing even support for people with breast cancer, for example, having ability to see lady doctors, because there's that resistance as well, would definitely help. With that, Dr. Kusumbat, is there anything that you'd like to share before we close out the session?
Yes. By the way, Ranak, it was an excellent talk and very informative. And what I would like to share is, sharing your needs and your problems with your family and friends. And when you share, you would know you're not the only one. I'm sure we all had gone through some time or the other the issues, whether it is a short term or long term or longer time. You will come to know that of course, when you have the issues, you feel, and we also feel that it's very hard. At the same time, probably people will have their own personal things that they have dealt with. Unless you ask, you would not know. Especially in the Indian community, if you feel that to have that stigma because I have it and I don't know how to do it and how to share. On the other hand, once you start talking about it, you will come to know you are not the only one. For that reason, take advantage of your community support, take advantage of your needs, and then talking to people, talking to your family, and talking to your friends. Because when we came to this country, we left our kith and kin, most of them back home, and then our friends became our own family. And then so for that reason, talking to them is very important. And then especially few people that you are close to, and then you will know how to deal with your own issues by sharing.
That's very well said. Definitely, we have family in India, and many of us left a lot of our family, significant portion of our family back in India. So I think it's time for us to choose our own family. I have several friends here who are my chosen family, now that we don't have all the family members here. So that's very well said. Dr. Bhatt, thank you for that.
I just wanted to add one more thing. I know when we have conditions, and then we all feel that is it ever going to end? There are times, and then you have a happy ending, and then look forward to having that happy ending and have a positive thinking that it will happen. That has happened in our personal life, and we had a child who had Guillain-Barré syndrome, where she was completely paralyzed, and we thought that is the end of her life. And now she's a grown-up woman and became a successful physician, as married and have children. At that time, it was very difficult. Things change, and then you will have happy ending many times also.
Yeah, definitely. Thank you for sharing that, Dr. Bhatt and Dr. Ranak Trivedi. Thank you for taking time to share this really valuable information with all our members. And so I'd like to thank each and every one of you who participated, the families, Datta families and Nurani families. Thank you for coming forward. When everybody wants to hide and don't want to share with their own friends, coming and sharing publicly, that takes a lot of courage and guts and willingness to serve other people who are going through similar situations. Contribution will be in many ways. Giving that moral support and sharing your own story is definitely a kind of contribution that you guys have made today, and we really, really appreciate it. And we are so grateful and valuable for all the valuable time that is spent by everybody, including the CWC volunteers here. Thank you, everyone. Have a great evening. Take care. Bye-bye.